Hey, everybody. Welcome to another exciting, wondrous episode of Clinic Gym Radio. I'm your host, Dr. Josh Satterlee, and it is my pleasure today to be joined by a couple amazing folks out in the Columbia, Missouri area, Dr. Curt Kippenberger and his lovely wife and handler, Krista Kippenberger. How are you guys doing?
Well, handling is what we're doing.
Doing great, man. Appreciate you having us on.
Absolutely. And I'm super excited to talk to you guys about about your progression in the world of the clinic gym hybrid, because it's been exciting for me to see it develop. Curt, I think we first talked about it when you were inside my gym 6 years ago.
Yeah.
When did you come through Vegas? Was that
2015?
Holy smokes. Hard to believe that's 5 years ago. Yeah. So can you guys give everybody a little bit of maybe background on kind of how big your facility is, maybe how many patient visits or whatever numbers, so give people some idea, how many exam rooms, some sort of layout so they can see it in their mind?
Sure. Yeah, we remodeled our space in 2017 when we added the gym, and we currently operate out of about 3,500 square feet. We have 4 doctors and generally at least one intern. Mm-hmm. Patient visit wise, across our docs, we see somewhere around 1,200 patient visits a month on average. And then the gym is about 680 square feet. We comfortably can operate a class of 6 out of that. But with COVID, we've kind of limited it to 3 to 4.
Awesome. And for the 3 listeners on here who haven't served as interns at your clinic at some point, or at least stop by, let them know the name of it and where, kind of what kind of city you guys are in as well.
So yeah, we're focused on health chiropractic, and our gym is called the Movement Lab. We're in Columbia, Missouri. It's, kind of a medium-sized college town, about 250,000 metro traffic and 150-ish standing population.
Cool. And you guys are basically in the center of the town, roughly.
No, we're actually on the outskirts. Actually, college students wouldn't even know where we were if they didn't. Okay. If we didn't kind of. Sometimes I do like Mizzou interns as well. And so they'll come out here and they're like, I didn't even know this part of town existed. I'm like, I know.
That's awesome. Nice. All right. Well, so I would love to cover this. So back in 2015, you kind of, we met each other in person. And I think that was just like the twinkle in your eye of adding a gym. Up to that point, you were just operating basically straight chiropractic office?
No, we've always
straight chiropractic office, a regular community chiropractic office. I should say it like that.
Yeah, we've always offered rehab. So before I took my first SFMA course with you in 2012, we would do a lot of stuff from Craig Liebenson's book and Stu McGill's work. And I think what we were doing was good for the time. And the SFMA kind of opened up a huge lens of opportunity to expand our rehab. And then, chatting with you at that first course, I definitely wanted to come and check out Biomechanics Las Vegas, because I'd always wanted to incorporate a gym somehow. We'd had some great relationships with other studio facilities, one of which is actually an FMS gym here in Columbia. And that was a good model. Like we would refer a lot of people that way. The trainers were great. I interacted with them a lot. I trust them. I trained with them. But yeah, when you started talking about the idea of keeping it in-house, or at least a lot of it in-house, that really sparked my interest.
And at this time, when you say you were always doing rehab, were you just doing that inside the patient exam rooms? I mean,
well, our first office was 1,200 square feet, and we laid it out like a traditional chiropractic office. So there was absolutely zero room for rehab. And we would knock down a massage table and do rehab in one of those rooms. I mean,
came out in the waiting room, and I was like, okay, let's go back here to another room.
And that was back in the day when we were like standing on top of physio balls and doing squats and stuff. So
yeah, Paul Check,
pretty epic. Yeah.
Nice. And so Krista, as this kind of idea, kind of came to Curt about, hey, let's open this up and keep it in-house. Since you're doing the business operations day to day, right? And you're coordinating things. What was your thought? Like it wouldn't work, or it was going to be a pain in the butt, or what'd you kind of start off thinking?
So after we moved out of that 1,200 square foot office, we moved into kind of like that medium office, and we did have room then for rehab. And so I kept telling him, you have enough space over here. You have enough space here. And I couldn't really understand what he wanted out of a gym space. I'm like, that's just going to be open floor and we're never going to use it. It's going to be wasted space. And so I think until he actually showed me in Las Vegas, like, this is what it could be, that I was like, oh, okay. Now I get it. And because we had that relationship with the gym, I just never thought about bringing it in. But yeah, so now it's in the house.
Great. Now, not to, I want to kind of keep going down the path here, but you just brought up a good point. Like, you had that relationship with the gym. When you added it in-house, did that mean that relationship ended, or is that relationship continued on?
Yeah, no, excuse me, out of respect to, the principal gym that we worked with mostly, I actually took this idea to the owners, and one of the owners literally looked me in the eye and he was like, do you not think that there's enough effing people in this town that we're both going to be just fine? And so the relationship continues to flourish. And we still refer people over there. There are needs inside of our gym that we don't have the space to meet. And they do a lot more with body composition and lifestyle advice. And when people are really wanting that kind of work or attention in their fitness programming, we welcome that wholeheartedly and refer aptly.
Yeah. And do they refer people back that are maybe too banged up or multiple previous injuries that just can't hang with the classes?
Yeah, absolutely. I mean, I would say over the years, just because we've all kind of came into having our maintenance, clients or patients, we see less referrals, but we still co-manage a ton of their clientele. And anytime that they have something that their clients aren't capable of doing in the gym because of a mobility issue or because of pain, we're their number one choice.
Awesome. Well, you're number one in our hearts too, Curt. I want you to know that. Yeah. So going back to the past, so you moved to this medium-sized office, I think, Krista, you were saying, and Curt comes up with this harebrained idea of adding the gym in-house. From a logistics standpoint, what were the things that were kind of rolling over in your mind about what needs to happen, what needs to change, what we need to do? Because I'm lucky enough to know Curt, and he is, if nothing else, man, he's got motivation and excitement, right? But I can only imagine trying to wrangle that into a functioning business. I think there's a business coach that said if it weren't for the operators, the dreamers and the dreamers would be sitting drunk on a curb, bankrupt, talking about the business they almost had going. So
yes, yep.
I think I still do that occasionally.
But at least you can sit on the curb drunk, but at least she has the bills paid and make sure that you're not going to, you have a bed to go sleep in that night.
Yes.
So what needed to change or what were your big hesitations?
What needed to change? Gosh, Josh, that seems like so far away ago that I can't even remember what my mindset was at that point. Hold on, let me try to think about.
Yeah, let me give you some time and let me just explain why I'm asking, because I think for a lot of people listening, like the transition from going from treatment and then adding rehab literally can happen at a weekend seminar, right? You go to the SFMA seminar and you're like, oh, I can just do rehab right here. It's not a huge jump for us. But that's because in our mind, it all makes sense. And we were just walk through a framework and a flow chart that, hey, here's how it goes. But when you go back to implement that or bill for it or make sure that there's coverage or there's time for it, or make sure that time that it's going to take, we're like, oh, it's just going to take me a couple extra minutes. I think you as the operations person goes, a couple extra minutes times every patient, we're now a day and a half behind on appointments, and sometimes we don't realize that stuff as clinicians because it's just like, well, I'm just going to do this real quick. At least that's how it happens with me.
Yeah. And maybe Curt can chime in here since he is like, I feel like the trainer of kind of that aspect of it. I go along with it and I try to manage it, but I feel like he is like, puts the people where they need to be and the time. He's kind of watching that as well. So maybe you can answer that better than I can.
Yeah, I think part of it is assembling a team, because if you're moving away from just traditional chiro or traditional chiro plus rehab to get people to, excuse me, man, to get people actually meaningful movement-based rehab or meaningful movement-based classes. You got to step through a crossroads, and it's, can you charge enough for you as a clinician to be that person and be all things? Or is it better to delegate? And, that's just going to really depend on regionally where you are, what reimbursements, if you're cash or insurance based. And so I think assembling the team is a big part of it. The time is huge too. You've got to look at, especially for us, since we operated as mostly a traditional chiro plus rehab clinic for so long, our patients would spend maybe 25, 30 minutes with us. But when they're doing that, 15 to 20 minutes of chiro treatment and then 45 minutes to an hour, now we're talking about their schedules as well. So we've got to figure out, times that work well for the Columbia community. And again, that can be different for everywhere. I'll tell you what, this year has been really convenient because everybody's been working from home. And the people that were in the gym, they were like water. They went wherever the appointment times were. So I'm not sure if that's what you're looking for, but at least maybe we're in the right book.
Yeah. And so progressing along that, so you get to this point, you kind of have that medium-sized clinic, you guys start doing rehab, you have the open space. And then when you have the larger clinics, now you're out of 3,500 square feet and you decide to commit a rather large portion of that. I mean, 700, what was it? 780? Is that what you said? 680?
Yeah. 680, 700.
Yeah. So that's a big chunk of the office, right?
Mm-hmm.
And you decide to commit it to a gym, right? An actual operating gym, not just a rehab space. How'd that progression go? Like, hey, let's actually start doing exercise. So I think a lot of people can do rehab, and even rehab, it starts looking a lot like a gym, but it's not sticking a stake in the ground, declaring, hey, this is going to be an actual fitness facility.
Well, I think we even tried to use our current team to fill that gym need.
Mm-hmm.
So we were like, oh, I think we're going to use this CA and you're going to start train. I don't know how we even thought that would work. Like, we're going to also borrow your time, the team's time to do that exercise within the gym. And she did a really great job at like getting it off the ground or somehow like.
Well, even before that, I think I know what you're referencing. Even before that, when we finished the build out and we started this idea, one of our CAs at the time who helped us with manual therapy and helped with some of the rehab, we put her through the FMS course. And we're like, okay, here's a gym. Like, go for it.
Make it work.
The two that were involved with it at the time, they had a handful of clients that would come over and they did some stuff with them. But I mean, there was no structure. There was nothing. I mean, it was just, we had this space that we were all dressed up and no place to go. And then the trainer that we actually brought in to really start it, I mean, we were really fortunate to go to your super conference down in Austin. And that's where the light bulb really flashed. When you and Dan Leonard and all of us came together. And I don't know if it was you and Dan that came up with the idea of making it a part of the treatment plan versus just an accessory to the chiro clinic. That was huge for me. And so I started literally just writing stuff down that weekend. And when we came back, we created a return to play strategy for every single one of our patients. And that was the big turning point. I mean, our gym isn't crushing it by any means, but we're getting a lot better results with our patients because they are going through the gym and they are getting to move and load themselves. But I think the puzzle pieces are finally coming together where the gym can scale and be its own, its own.
I definitely want to cover that. And Krista, I would love to cover the function of the gym within the operation of the clinic, logistically moving patients around, but also like, was it worth it financially to establish that space as a different type of treatment? But Curt, I just want to go back to something you said, because when you're at that super conference, so the goal of super conference, back when, number one, it was to get people together, which is highly looked down upon now, but we were actually trying to get people together. And what it was a day of all the business operations and systems, and then a day of the CFSC for those who weren't able to attend the Certified Functional Strength Coach program. So it was a systemized exercise program, one day, and a systemized business plan the other. You said that, making it a part of the treatment plan was a big deal. And I'm glad you said it like that, because sometimes, what I think is like, oh, this is just how it is. When you have the gym, you just make it part of every treatment plan, right? But what went through your mind, and what were some of the big points you took home that time of how to actually do that? Because I think there is some hesitation out there with people who want to change their model or even are looking at starting. And it's like, the facility might have both options, but there's not a clear line from A to B.
Yeah, I think the biggest thing was we just had so many friction points when the trainer that we had at the time would do a functional movement screen. She believed in what she was doing. The clinic believed in it. But it was, I guess maybe it was because it was an option, and there's so many options. I mean, people get menu anxiety about gyms, right? Like they could go to the big gym in town, they could go to all the other studios, or they could come to the chiropractor and go to the gym. And that was just like, it was kind of weird because it was a part of it, but it wasn't really integrated. And so,
and I don't think it really had a system into how to flow people into the gym. Right. We hadn't really established that system to get people to be like, oh, okay, well, what's the first step? We didn't know. We're like, oh, if you say yes, then we'll go, So I think when Curt came back and said, this is the system that it's supposed to be, we ran with it, because then we had like something on paper that said, this is the first step for the patient to get in the gym.
And I know you've mentioned
what was that first step? So, I mean, like somebody, like you're saying, hey, people, they wanted it. They want that service. And it is funky that we go, hey, we want to offer the service. And I've seen this 100 times. We want to offer the service. We want everybody in the gym. And then the person goes, okay, I want that too. And then it's like, and it's like, what do we do?
It is that next new patient you have, the doctor says it right there in the exam. All right, so we're going to get you treated. And part of that is in the gym as well. And I'll tell you more about it in our report of findings. And then the report of findings comes around and you say, okay, we're going to, these first 2 weeks, we're going to do adjustments. We're going to get you out of pain. And then these next 4 weeks, you're going to be in the gym twice a week with Amy and blah, blah, blah. And so the doctor paints it right there. This is part of the treatment plan. This is what I expect. And then,
so it's like, it's not just that the doctor paints it to the patient. It's almost like you guys had to tell yourself, we're going to treat you for 2 weeks, and then we are going to move you to the gym. And then you had I'm sure you had a mirror in every room, and they had to look into it and say, I'm going to move this patient into the gym.
Yeah. Or Amy's going to take them from there. Yeah.
All right. So you committed to it. Yeah. You committed to it.
Oh, sorry.
I'm talking over you. So you committed to it by telling them early on, hey, and basically you're breaking the seal. And I think this is important for people to hear. You got to do that from the day one. If you wait for the third week to introduce this idea, the fourth week, or when they're out of pain and you're really thinking about, oh, well, the next step is, it's already too late. And that's not just in the clinic. I mean, I'll tell you in the gym, if you run a challenge and you're like, hey, we're doing a weight loss challenge, it's 6 weeks long. The absolute worst time to try and sell them, as crazy as it sounds, is after the 6 weeks to try and get them into membership. Crazy enough, the best time to sell them is week 1 when they haven't had any success. For whatever reason, we as humans psychologically will commit to you then. But man, once we go through 6 weeks and it's like, hey, I lost, 18 pounds. I feel great. I'm sleeping better, blah, blah. And it's like, let's sell them into membership. You can't get hold of them. You can't reschedule them. Their motivation's lower. And you would think on paper, that looks like the perfect time, right? After I get you to lose 18 pounds, I'm going to have you sign up. But it's not. It's before they've lost a pound that they're most likely to sign up. So I hope everybody's listening here. Like, this is from the battlefield information. Like, do it day one. There's not a better time.
And just coming from a lay person, and I always say that in my practice, I'm like, I'm your patient. I'm the one who you have to tell me what you're going to do. They want a plan, and they want to know that you're confident enough that we're going to fix you and we're going to make you even better than you were before, because we're going to put you in the gym to move you. And so when you have that confidence and you have that plan for them, they didn't have a dream. They didn't have a plan that they were going to follow. They just knew they were in pain. Okay, well, that's the easy part. I'm going to get you out of pain first, and then I'm going to make you even better by putting you in the gym. So I think when you can give them that picture, they're going to follow it because that sounds better than they even thought.
Now, how is that now that you are this is just normal operations, is to make sure that the gym is included in the treatment plan? How do those patients feel? How's their confidence level? How's their thought of the chance of you guys actually fulfilling on this, which all patients have that doubt, right? Like I think I'm in the right place, but we'll test it. How has that affected the confidence of the patients fulfilling their treatment plan versus back before you offered that? So before it was, hey, we're going to get you out of pain and then we'll part ways. And now you're saying, no, we're going to get you out of pain and then get you exercising. And I'm sure there's some people listening going, well, that's going to put up a huge barrier. That's going to create more resistance because I'm selling them on this long-term thing. But my experience is, well, I don't want to tell you my experience. I'd love to hear your experience first, and then I'll tell you my experience after.
Yeah. One, we had some really great systems set up prior for people to follow their treatment plans. And, especially after adding, ChiroUp as a software, we realized how many people are actually opening and looking at the exercises that we prescribe just out of the rehab department. So we've had a good buy-in for rehab for a long time. But I can honestly say when we implemented the gym and we said, this is part of your treatment plan, there's like sparkles in people's eyes. Like they're like, whoa, not only do you want to get me out of pain, not only do you want to give me some self tools at home, I came in and telling you that I can't lift my kid up. And you're telling me that your goal for me is to lift, 100-pound kettlebell off the floor. I think that the people that we are serving are a lot more engaged, and I think they really enjoy their care. It's actually a more fun work environment too. I think our team is really more engaged because they're seeing people not only take control of their own health, but then we're breaking down these barriers of people. One of our trainer, Amy, right now, for like 5 or 6 meeting weeks in a row, her good news was this one client that was really, really in a lot of self-doubt. She was really kind of depressed. And now, her goal is to, do a body weight pull-up. She's deadlifting her body weight off the floor. The empowerment that's given this woman is super incredible, and it's really impactful.
And I think like our wellness patients or our maintenance patients, that when we had got them to, before we added the gym, when we got them to kind of that maintenance phase where they're just coming in for chiropractic, they'll still come in and we'll have these conversations and meetings about, they have this issue now, they have this mobility issue now. And it's like, if we had them in the gym or could get them to the gym, they wouldn't have this now. Like we were not serving them right by just prescribing chiropractic as their maintenance. Now we can do the gym side and really make that the maintenance part of it. They wouldn't come back with these issues. And so that's one of the challenges we're having now is, how do we get the rest of the population who are maintenance, who sees the gym once a month over there and says, what do I do with that? And so after reading your book, I'm doing those emails you had said to send out. So we're doing that right now to everyone in the office, just to educate more about what that gym is over there and what it can do for you and things like that.
That's awesome. Well, I think right now would be a great time. I need to do a live read for our sponsor, which is Clinic Gym Connect, but you just reminded me of it because, the point of Clinic Gym Connect for those listening is to make sure that you're communicating on a regular basis with your clients. And the best way to communicate for today's clients is through text messaging. Emails are fantastic, but it's harder and harder to get people to open them up and read them and watch them. So Clinic Gym Connect is a text-based communication software that allows us to talk to our patients, to inform them. And one of the great things you can do that Krista just reminded me of is send out a series of automated text messages with a link to a video. So if you wanted to explain a new service you're offering, like a gym, you can record 4 videos and send them out 2 days apart, and we can grab those people early on with that and put them into that automation early on so they understand why we offer fitness as an option, how to get involved, when it is, and then we can even make them a special offer based on their condition or based on their how many appointments they have left and whatnot. So it allows that communication to happen so that nobody is left wondering why why there is a gym in the office, and everybody understands because we've done a good job of explaining to them. So if you're interested in that, check out clinicgymconnect.com. Once again, that's clinicgymconnect.com. So now we're going to go back to Krista and Curt. So you just reminded me of that. So I thought it was a perfect time to do our sponsorship message, because communicating is such a big deal with patients. I mean, once you establish communication, I think like they're portable. I say they're portable. So if you're, during COVID, if you're like, hey, we're doing a park workout, and you got to let them know, that'd be a good measure, is if you can get the message out, like, there's all these fancy marketing schemes, but it's just like, are you just communicating regularly? I
know. And you said that in one of, whether it was a podcast I was listening to, that you think that your patients know what is offered in the clinic. You think that you're communicating, but it's probably the fact that you're not. So just over communicate so that you are getting the word out that there is a new service, or that the gym is over there for them as well.
Yeah. I mean, it's crazy. There are examples every day. I mean, even in personal relationships, like, Curt, if you just remind Krista, hey, don't forget I'm picking up the kids from school today. You almost can't say that too many times, right? There's no downside to you. I know you told me last night. It's like, all right, well, I just want to make sure, like, there's no downside to that, and as long as you're not annoying and not a pest, it's crazy. But you would be shocked at not just you guys, but every practice in the United States and has a service. And if you ask half the patients in there, did you know that we offer massage? Did you know we offer a gym? Did you know we offer, baseball evaluations? Half of your patients are going to say no, or they're going to say, I kind of knew that, but I didn't think that I was allowed to, or that I was, could do it, right, and whatnot. And it's so funny. You want to pull your hair out, like, my God, like, we sent 750 emails. Yeah. I'll tell you a crazy one. We have an app for our company. Clinic Gym Hybrid has an app, a custom-made app. We spent a ton on development, a ton on, we have a whole team that puts content in there. And the other day, one of my team members who was hired after that thing goes, hey, someone on Facebook said you have an app. Is that true? I'm like, our internal team didn't know that. And I'm like, oh my God, I have failed. Anyways. So let's go back to something you said earlier, Krista, that I really loved, is you mentioned that the attitude or the feeling in the clinic changed once you added the gym. Can you kind of tell us a little bit about that, or talk a little bit about what the changes you noticed were? Because one of the things I love about interviewing both of you is Curt's basically in the exam rooms, working on people, doing the history and whatnot. But because of that, I think you're distracted by the overall sense of what the patients are like that day, right? You're getting these one hit, whereas Krista sees the flow of things. And sometimes those two things have a little bit different story or a little bit different sense. So I'd love to hear how that went for you, Krista.
I think the definite attitudes is you hear a lot more patients going or giving a testimonial on the fly. Like, they'll get up from an exercise and they're like, wow, okay, yes, I'm going to do that. I'm going to do that because that made me feel good. Or I'll hear somebody in the gym with Amy, like the other day, someone was working out with Amy, and like, she knew a new patient who was coming over to get like her first exercise. And she was like, I love this place. I'm just working on getting stronger now. And the lady's like, oh, you are? Oh, wow. And, so they were just like, she was like selling her on like, you've got to get over here and you've got to be part of the gym. And so I love that, because we can always go into meetings and talk about good news because it's all over the office. People are just like overflowing with testimonial and good news. And sometimes, as a team, we forget that that's not everywhere. That doesn't happen everywhere. Like, and so that's why we like to bring it up in meetings, is like, people are not hearing this in everyday doctor's offices or even everyday chiropractic offices. And so, just a good reminder.
Yeah. I mean, there are days in clinic where, for whatever reason, there are, you get a string of happy people towards the end of their care plan, but man, there are days in clinic where it seems like everybody is worse than the day before, or they've got some crazy, either emotional issue or crazy, they just lost a family member, or they're in tons of pain, or you're getting new patient after new patient that's just dying in pain, and it just wears you down. But one thing that's so great that I know about having a gym is there are very few bad days in a gym. I mean, like, even if they start out that way, by the middle of it or end of it, you get a couple people high-fiving each other, that changes the mood of the whole building, and it just fills that place. And it's really tough to have a rough day in the gym, even if the person has a quote unquote rough workout. Like, Chris, I know you've been working hard over the last 6 months on a couple things, and you might have a quote unquote rough day, but a rough day in the gym is 1,100 times better than, most rough days elsewhere. So,
well, yeah. And I'm like that 7 a.m. worker outer. And so like, I am not always in like the best mood when I start, but I'm like at the end, yeah, I'm ready to go and conquer the day. And by the end, I'm in a really good mood.
Yeah. Curt, have you noticed a difference in patients? We talk about the biopsychosocial model of healthcare, and I think the social aspect definitely gets short shrift because we don't get them into social situations for rehab and exercise. And even the psycho part of, like body weight pull-up as a, shoulder or neck rehab is almost unheard of, yet what that does for patient buy-in and whatnot is so different. What have you noticed the changes of your patient base as you've added the exercise, and especially those that get at least into their first, second, third exercise portion as part of their care plan?
Yeah. I definitely see kind of like the cheers thing kicking, right? Like, so you'll get a handful of clients and patients that are sharing the same class, and Krista's class actually that she's in is some of the most consistent people week in, week out. And so when I'm in the treatment room with these folks, they're talking about the camaraderie that they've, joining the gym, how Krista likes to give people shit, and that this person squatted more than that. So yeah, it really has created almost a community. That's something that CrossFit did really well, right? Is they created a community, and that following bred success. And I think that's what we're seeing too, is we're kind of creating more of a place to go versus just a thing to do, if that makes sense.
Yeah. How about the willingness, or, a lot of clinicians struggle with patient compliance, right? Like, oh, well, they're not complying and doing their homework. Has that changed with the addition of the gym?
I think to a certain degree. I think that we're getting more people that are continuing to do, their home stuff on a more consistent basis. I think in the past, we've been really successful at getting people to do their home stuff until they're out of pain, but not making that a regimen. And, part of the system that we've created is, on our first day, we do our evaluation, we do a clinical audit, we render our differential diagnosis. The second day, we do our reported findings, do treatment, give them their first layer of home exercises, and really following that reset, reinforce, retrain, and reloading strategy the SFMA teaches. We tell them, this is what you're responsible for at home. Like, we have a three-leg ladder, or a three-leg stool here. I mean, we've got our clinical team, our performance team, and you. So this is the stuff that you're responsible for. And if you do your work, I know these other two guys are going to do their work. We have no doubt that you're going to get great results. So then when they come back for their third treatment, or essentially their third day in the clinic, now we're starting to work through that 4x4 matrix. And as soon as they feel, whether it's pressurization or their glute engaged for the first time, whatever, there literally is like a spark that goes into their eye. And one of my docs here in the clinic, Dakota, he did a presentation for one of our training days. They get a movement experience now. Before, we gave them exercises. I think what the gym offers is a movement experience, and the return to play strategy is part of that. The in-clinic rehab is a part of it. The patient's take-home stuff is a part of it. And then once they hit their FMS, they get a whole nother set of take-home exercises. So it progresses them at home as well as in the office.
Yeah. Yeah. And the FMS, was first developed as like a discharge criteria,
right,
for a PT clinic. And I'm sure once your patients get that FMS, how would I say this? Your young interns realize that they better bring their A game, because the FMS is going to audit them, right? Like, hey, yes. By the way, you did a great job on the right hip they complained about, but the left hip is garbage. What are you doing about it?
Right.
So I think you guys probably have the best system. You reminded me, I know Dakota is a stud, and you're Clinton, like that kid's just got a motor inside of him, and it's awesome. And you put through a bunch of other interns, Ryan and Tyler Panko, who had to step up like Superman. And it sounds like a great experience. I know you guys also have a program to train young interns if they're interested in this model. Can you talk a little bit about that for some folks that might be at that point? If they're listening, this is really for people at the tail end of their chiropractic college career, right?
Yeah. Yeah. And we have a few options. I mean, one of the greatest benefits is the preceptor program, regardless, like find a good office, go learn from somebody you respect, somebody you trust. It was one of the most influential pieces of my academic experience. But, places, good chiropractic offices can't take every intern. I mean, we can only handle one at a time. And there's, you got to be out for 3 years. Finally, Ryan's going to be able to offer, another preceptor opportunity. So we might be able to house 2 at a time. But we also are putting together a program that will kind of coach you through processes from an online standpoint. And we've lovingly called it Try 11. I know there's quarter systems and try systems. I was a try system, so it's Try 11 and not Q13, which actually sounds kind of cool. It'll basically give you a framework of how to create a business model and some systems that we think are important. And that can include the gym. That if that's not your bag, then there's, obviously ways that you can do it. But, from what you hear in your podcast and interacting with you, especially if you're a movement-based chiropractor, there's really no better way to practice by incorporating a gym. Because talk about audit, you have a test at the end. The FMS is a great audit. And then, if you start to load your patient and they're still in pain, man, you didn't serve them as a chiropractor. You didn't serve them as a movement specialist. And so I like that accountability of having the gym in the clinic.
Yeah, it makes everyone better, right? It's better care for the patient and also makes the team better. And you can see, like, I thought I did a good job of retraining that hip, but as soon as they grabbed a kettlebell, it all fell apart.
Right.
I think
that semantic change in the SFMA was really brilliant. I think the retrain is definitely there, but the reload is huge too, right? Like, it's one thing to be able to pick up a laundry basket or a kid, but can you do it automatically? Is there, conscious competence and unconscious competence there with that movement?
Right. Yeah. So for anybody listening that's maybe considering this, the addition of this to their regular clinic, or they're launching, what tips do you guys have for them? Maybe a final thought or a final tip on, do XYZ first. Because I think, Curt, you were lucky enough to already have that seed planted. And then, we came up with the super conference at about just happened to be almost right, perfectly in line with your timeline. And it was, that was a pretty damn fun weekend too.
It's a fun weekend.
Yeah.
Our most recent preceptor who left, went to Kansas City. And I looked at him when he was leaving and I said, this is your chance to start the gym from patient 1. They will know no different. You will know no different. And it's starting from day 1, because he was going into a practice where he was renting a room that also had a gym access. I was like, perfect, just do it. And so I think just being able to take the knowledge of knowing how a gym works and then just starting it in that practice from day 1, and nobody knows any different, is pretty cool. But if you're trying to start it like now and you're in a regular practice, start with that next new patient. It's Tuesday at 1 p.m. Okay, that's when we're starting to offer the gym, and or in their treatment plan gym, and that's going to be the new system. It's just put in place right there.
Yeah.
And have the confidence to know that it works, and hand them the plan and walk it.
The one of the most impressive things I've seen over the last year, we have a guy I've done a little bit of consulting with him, and he rents a room from another chiropractic office, and he believes in exercise so much that for 6 months, he had a use agreement with his apartment complex and their gym to bring patients in there and work with them. And it was like awesome. 2 blocks from his office. And he's like, all right, Tuesday afternoons and Thursday afternoons, we're in the gym over here and work with them. Because, you know, apartment complex gyms never get freaking used. And they had a great gym they'd invested in. And I was like, dude, that's commitment. I mean, because like to me, I'm like, there's some, you know, sense of like, it doesn't have exactly what I want. It's a little bit embarrassing. It's, you know, all these things. And he's like, this is what patients need. They just need the gym, and I have access to this gym. I'm going to do something. And they were renting it to him for something like, he said that the guy's like, I don't know how cheap I can do it, but how would you feel about $64 a month? He's like allowed to bring as many patients as he wants in there for $64 a month. He's like, yeah, I think I can handle that. So anyways, awesome. Yeah, but I was just impressed. Like, man, what a commitment. Like, you have access to that facility and you are saying, hey, I'm going to do it. I'm going to bring every patient here, and you do it every Tuesday and Thursday afternoon. So I was wildly impressed, but yeah, you're right. There's so many opportunities out there.
Is how will that comes across as how will I also do the exercise? And so I was telling Ryan, who is our recent preceptor, I'm like, well, you offer a 7 a.m., then you go to the office at 8:30 and you start treating patients. And then maybe we have an afternoon class that you block off, and that's you also train, or an evening. And so if it is you just running the show and you're only a one man, you can still do that and still offer the gym, and you will grow so quickly. You'll need a trainer very quickly. And then also a front desk, you know, like front desk and trainer can be the same person maybe, or, you know,
front desk, trainer, CA, they can do a lot of things. So yeah. It's that's impressive. So Curt, what's your big tip?
I think, you know, especially if you're still a ways out from graduating, even if you're in practice, it doesn't matter. Go find a clinic gym, like go live in it for a second, shadow. I mean, that's exactly how it started. I had the idea. I couldn't see the picture. And when I saw Biomechanics Las Vegas, I was like, wow, this is what it could be. And I was in practice for 5 years, and we still 10 years in, and I hope to be doing it 30 years in a practice. We will go shadow docs that I respect and that we think that we can learn from and take some stuff away and just co-share things. So I think getting out there and seeing it in action, that's something that our shadowers say a lot. They're like, we really love this idea, but we couldn't figure it out. And they were in the same shoes I was. It sounds silly, but continue to listen to folks that you bring on the show. And there's so much to learn from, you know, the Chip Blems and all the other folks that are following the clinic gym model. I think that initially I was like, okay, I saw Biomechanics Las Vegas. I think I've got that figured out. And then when you were rolling out clinic gym, we had established a good friendship at that point. I was like, man, yeah, I think I got this figured out. Like Josh and I talk all the time. That's all I need. And that was nothing further from the truth. Like, I needed more mentorship. And when we got to the super conference, that was kind of the thing that popped the egg. So yeah, fingers crossed. The other thing that you should do is when we can get back together, you should host another super conference, because I think everybody listening here should be there.
Already in the works, my friend. Already in the works. So yeah,
I'll guarantee that I'll break dance for you if that's.
There you go. Yeah, yeah. One thing too, Curt, that along the way, that I know you guys have done a good job of from the outside perspective, it's not just that you observed, but you really seem to get involved in groups that were presenting a system. So the SFMA is a systematic approach to evaluation and rehab, right? Mm-hmm. And CFSC is a systematic approach to exercise progression, regression, and even in business, business operations, you guys seem to systematize things well. And I think that's important for people to look out for. Like, there are a lot of good courses out there, but if they can't hand you the outline of it, on one page, it's like, maybe it's not refined enough. That's one thing that I've always loved about, and that's one of the reasons I tell people, like, the CFSC is just the only systematic approach to exercise I've ever seen where I'm like, this makes perfect sense, and it's A, B, C, or D. Now, you don't have to stay in that your whole time, but just start there. Tell your patients, hey, this is where we're going to start. We're going to progress to here. And it offers reassurance, and it's just like when you take your kids to the pediatrician and they're like, hey, we're going to do these four, we're going to do these things in this order over this many years. It's like, okay, well, although I might disagree with one or two steps within there, just the fact that it's laid out is okay. Now I have clarity,
Right.
And I think that's a huge deal. So, I certainly appreciate you guys being on today. So you guys are Focus on Health Chiropractic in Columbia, Missouri. For those listening that are like looking for something to do, either preceptorship, I think it's worth reaching out. I know you guys get hit up all the time for that. So don't be heartbroken if there's no room for you if you're listening to this. But then also check out that Try 11 program, which is basically what to do once you graduate for the next few months to really learn this, right?
Yep.
Awesome. And even if somebody can't preceptor, I'm sure you guys are gracious enough to allow them to observe for a day or two.
Yeah.
As long as they provide really good coffee and are willing to sip bourbon with you afterwards, right?
Exactly. Shadowing just offers an opportunity to create a relationship. And kind of the cool thing about hanging out at all these cool conferences and SFMA courses and whatnot is we meet a lot of great people. So if we can't place you in Columbia, we might be able to get you involved in Tennessee with Dr. Holm or in Troy with Dr. Winchester. There's so many great places that want to help cultivate this profession in an impactful way. And we're fortunate enough to know a lot of those folks.
And bring your questions. We always have people asking, really great questions. That's how Try 11 came about, is like those questions we took and made course content on it because we got asked that a lot. So we're always listening and wanting to hear what you need answered, and we'll add it to the digital course.
That's awesome. All right. Well, on behalf of the team Kippenberger out in Columbia, Missouri, this is Dr. Josh Satterlee saying, go out there, maximize your license, and live the life you dream of. Thanks so much, guys. Thanks so much for checking out these videos. I hope they're useful. We'll cover things like rehab, exercise, business model, progressions, layout, everything else that helps you build a clinic. So if you're interested, you can click here, there, here, or anywhere to get more videos just like this. Thanks a lot for watching, and we'll see you soon.